trying to fix your lower back pain, but are you treating the symptoms or the cause? Because there's a massive difference. And if you're wondering what that means, don't worry, I'll cover all the detail in this video. Hi, I'm David Fitzgerald from Dublin Physiotherapy Clinic, and if this is the first time you've seen our channel, I recommend you subscribe to catch our weekly videos. Let me explain what I mean by symptoms and causes. Symptoms are the obvious feelings which tell you something's wrong, sometimes where it hurts and sometimes not. And if you're like most people, all you really want is for them to go away. But all too frequently, attention is focused on treating the symptoms and the underlying causes get ignored or neglected. Identifying the cause is the most important thing, because treating pain doesn't tell us why it's there in the first place, and especially if it keeps coming back. Check out our other videos we did on this topic. It's like switching to a healthy diet after a heart attack. You definitely need the immediate symptoms treated, but you also need to look at why the problem occurred. The crux of our challenge clinically is not only to identify structures that are causing symptoms. I'm sure you've heard of things like discs, sciatica and arthritis, but more importantly to identify why these tissues are painful. Sometimes it's obvious and there's a specific history of injury causing inflammation, but almost as frequently there isn't a dramatic history, and people are somewhat mystified as to how symptoms occurred with something as simple as putting on your socks or lifting the grandchildren. This is such a common story we hear in clinical practice that it always alerts us to an underlying process which we must explore in greater depth. There's a lot of detail in what this type of exploration involves, and most don't want to know the detail, just the solutions and long-term prevention. Of course, there are some conditions which don't respond to physiotherapy and may need a surgical procedure, but these are easy to identify and must be selected quickly for the appropriate treatment. The good news is that for the vast majority of spinal pain patients, there are usually combinations of manual treatments, corrective exercise and preventative strategies which can be put in place to radically reduce the severity and duration of low back symptoms. This type of examination takes time, sometimes 40 minutes to an hour, and treatment always involves collaboration of both patient and therapist. The key is making the rehabilitation work achievable, practical and progressive in bite-sized chunks with a view to achieving your desired outcome. I can't emphasise enough the importance of visiting a physiotherapist specialising in low back pain to get clear on the cause of your pain. It will put you on a faster road to recovery and avoid going down blind alleys. Before visiting a physiotherapist for the first time, I have 5 key questions you should ask them as you make your booking, so stay tuned for that video. If you'd like more detail on what a thorough spinal examination should involve, check out our website dublinphysio.ie to get greater detail on this. I'll see you again in another video. Bye for now.